Good afternoon, everyone. My name is Mariano Soler. I'm the Vice Chair of the European Rural Youth Observatory. And with my other partners in this project, we will present this third webinar of our NEVI-EVY project. I will shortly introduce our project, and also you can have more information on our website. So we are making this project funded by the Social Innovation Initiative about disabled people. So we are testing and creating a job crafting model to help disabled people to join young people to have a better and proper work. So with Institute of Structural Research of Poland, with Center Kontura from Slovenia, with Fundacja Aktivizacja also from Poland, us that we are based in Portugal. We are making this project to better understand and to have a better work for disabled people. So today we present this third webinar with Magdalena. I will present briefly her work. If you want to pass to the other slide so we can see you and your title. Okay, thank you. Okay, so Magdalena Consejo holds a PhD in political science and administration, and she is currently an assistant professor at the Department of Social Policy in the Warsaw School of Economics. Her academic background is strongly interdisciplinary with degrees in sociology and psychology, which clearly informs the depth and perspective of her jobs. She brings over 15 years of experience as researcher and evaluator with a strong focus in disability policy analysis. Her work particularly addresses the right to independent living and examines the situation of women with disabilities within public policy frameworks. She is author and co-author of numerous publications and reports in this field, and she actively collaborates with a wide range of ONGs and public institutions, contributing both in research and experts. So today we have Madalena Consejo with us. Thank you so much for presenting this webinar about understanding personal assistance, pathways to independent living. So the floor is yours, and thank you so much.
Thank you very much for the invitation and also for the introduction. Yes, I will be talking today about personal assistance and how a special kind of a service it is, and how a personal assistance is a service that is very much connected to the right to independent living. Like, this is a service that is this is a heart of the whole independent living approach. I will also introduce what the independent living philosophy is. The plan of this presentation is that I will start with the short introduction to the independent living movement and independent living philosophy. I will tell you a bit about how the movement emerged and what were the consequences for the global disability rights movement. Then I will shortly tell you about CRPD, Convention on the Rights of Persons with Disabilities, and especially about Article 19, which is about the right to independent living. And I will discuss briefly how the independent living is understood under this article and how personal assistance is understood under this article. Then I will go to general comment number 5, which is general comments are the comments that are provided, designed by United Nations CRPD committee, which help us to understand how we should understand things, especially as CRPD is a global human rights treaty, and it can be understood different in a different contexts. But I will tell you what you can find in general comments about personal assistance and independent living. Then I will go to the distinction between personal assistance and care services, as in many cases there sometimes there is like some I don't know how to call it, like some chaos around them that for some people, especially for some decision makers, they are seen as the same thing, and they are definitely not. Then I will go to implementation standards and quality indicators, which will be about what exactly personal assistant is. And how should we implement this service? And then I will tell you briefly about personal assistance in Poland, because I believe that we cannot really discuss such a things without specific contexts. And the context is different for many of us, and my context is in Poland. It's also important to me to tell you a bit about my standpoint on this, because as you, even though I'm an academic and an expert on disability policy, I'm also consider myself as an activist and an ally on the disability rights movement in Poland. And being said that is, I believe that personal assistance should be implemented broadly in all of the countries. But my focus is in Poland. I was involved in the struggle for Personal Assistance Act in Poland for many years now. So I think this is important to also to recognize the fact that my position is not neutral. Okay, so some historical contexts about independent living. I believe that many of you heard about the concept of independent living, as we are here. As our meeting, also our webinar is in the framework of the project that has a focus on disability. But just to make it clear, because usually, especially in post-socialist Europe, we forget about that the context has quite a long history. So the history started in the United States in the 60s and in the 70s, and it started like as a movement. It began in in the late 60s, early 70s, as a response to the medical and charitable views on disability, which were very common back then. And to be really honest, it is still now. The movement was led by people with disabilities who wants them to be recognized as right holders, as a people with the full autonomy, with the right to self-determination and to the right of control, that the people who have the right to control over their own lives. They fight for the shift of the paradigm from the medical and charitable model of disability to the model that it's more based on human rights, civil rights, and also that the model who is recognizing also the barriers in the society, barriers in the very different kind of barriers that people with disabilities are facing every day. So this is so-called social model. So this was the beginning. This was the fight that people with disabilities have the right to have control over their own lives, and that they should have the full civil rights. It was, of course, connected to the feminist movement or other. Other discriminated groups, movements, but people with disabilities, usually in this whole civil society movements, were left behind. So they want to stand up for themselves and say, we are here, we have rights, and we also have a right to live independently. So this was the beginning. What are the core principles of independent living? As I said, it's self-determination. Self-determination is really in the heart of independent living. That it means that people with disabilities can have control over their own lives. They have autonomy. They have control. It also means that they are the best experts on their needs, that there is no need for medical doctors, specialists on rehabilitation, and other non-disabled experts to tell them that this is what you need, this is what you can or can't do, that they are the experts on their own lives. So that they can have control over their own lives, but they can also have control of what kind of support they will get. Another principle is something that is called peer support. Peer support is that it's about recognizing the fact that people with disabilities share similar experience, and they can support each other in that. So this is like supporting each other. It's supporting each other also in a way of supporting each other in a for like helping in understanding how to use specific services, how to get access to specific services or specific rights. What is also very important in the whole philosophy of independent living, it's that it's against institutional segregations of people with disabilities, and that people with disabilities have the right to live in the local communities. Oh, I see the biggest expert on independent living in the room. So, hi, Camille. I will be quoting Enil a lot. I hope if you feel that you want to jump in, feel free to do it anytime. Um, and then Convention on the Rights of Persons with Disabilities came. I'm sure that you've heard about CRPD. And you know that this is a human rights treaty that focuses on disability rights, that it was introduced to the global audience in 2006. And all of the European countries and also European Union ratified CRPD. It varies in a different country where it was exactly. But this year, we are celebrating 20 years of CRPD. And the heart of CRPD, in CRPD, we have 50 different articles. More than 30 of them is about different disability rights. But something that is like the heart of the convention, that this is the heart of the convention, that but it's also the article in which when we understand this article, I believe that then we understand better the whole CRPD, is Article 19. Article 19 is about living independently and being included in the community. And also, this is the article in which we can see the personal assistance explicitly mentioned in the Human Rights Treaty. And also, this is also the way, like the starting point to understanding what personal assistance is. So I will read it to you, like the whole article. I have it here prepared because I think this is the one that it's very important to read to read and then to understand fully. So, states parties to the present convention recognize the equal right of all persons with disabilities to live in the community with choices equal to others, and shall take effective and appropriate measures to facilitate full enjoyment by persons with disabilities of this right and their full inclusion and participation in the community, including by ensuring that A. Persons with disabilities have the opportunity to choose their place of residence and where and with whom they will live on an equal basis with others, and are not obliged to live in particular living arrangements. B. Persons with disabilities have access to range of an income in-home, residential, and other community support services, including personal assistance necessary to support living and inclusion in the community and to prevent isolation or segregation from the community. C. Community services and facilities for the general population are available and on equal basis to persons with disabilities and are responsive to their needs. So you can see that in this article, we see at least three very crucial things. I will start with the last one, is that all the services that are in the community should be services and facilities that are in the community should be accessible also for people with disabilities and responsive to their needs. It means that accessibility is very important, but accessibility is not enough. And at the same time, under this article is very important to realize, to understand that what is really crucial is to ensure that people with disabilities have the right to choose their place of living, that they do not live, that there is no such a situation that their only choice is to live in an institution, that there are other options available, and also that they should have access to very different services, and one of these services should be personal assistance. But of course, when we think about human rights treaty and CAPD is one, it's also very important to realize that even very general concepts or can be understood in a very different way in different contexts. And this is the way that independent living or community living can be understood very, very differently. As I see many people from Poland here, you probably realize that when we are talking about independent living in Poland, sometimes there is this assumption that we are talking about independence like in a very economical way or rooted in a very neoliberal approach. Is that we see that people with that when we hear independent living, we think, oh, it's independence of the, or that they are not dependent on their families and that they have their own income. So, but this is only like part of it, and independent living goes much deeper. Also, the way we understood community, it's completely different here in Europe. It's probably different in Western Europe and in Eastern Europe and in South Europe, but it's completely different also in Global South. So it's very important then for the UNCRPD committee to give us the guidelines. How should we understand Article 19? So in 2017, they gave us General Comment number 5. And they try to explain and go deeper into the understanding of independent living and the right to independent living. And what we can find in this general comment, which I highly recommend, and I think it's very crucial for every person who is working in the field of disability rights or even disability policy understood as a social policy, for example, to go through general comment number 5 and to understand how independent living is understood, how it's explained. So I won't read it, like I won't go through whole general comment as it's very substantial and it's very like and it's also quite long. But what I want to focus on is I want to focus on the fact that we have we have a definition of personal assistance there, and also we have the recognition of the fact that personal assistance is something that it's called empowering form of support. This is very important, and I want you to remember that personal assistance is an empowering form of support. And I will go back to that later. There is also a definition of personal assistance in General Comment number 5, and the definition said that is in this definition we can see that personal assistance is defined as a person-directed, user-led human support available to a person with disability, and is a tool for independent living. So we can see here like how the connection looks like, that personal assistance is a tool for independent living, and we know for now what independent living is, and like that the main principle of independent living is choice and control and autonomy of persons with disability. So the aim, so it lets us to it lets us to the fact that personal assistance is a service that main aim is to, it's like a tool for ensuring the right to independent living. And we understand the right to independent living as an access to many form of support to live in a community. But at the same time, we understand independent living as ensuring that people with disability have full control of their life and can make a choices for themselves. And then this elephant in the room, care services. We have personal assistance and we have services. And what is the difference? The difference is very crucial. I mean, it's very important to understand that personal assistance is not a care service. It's a completely different kind of service with different aims, different principles, and it's like in a completely different, not even approach, but I think a paradigm is better word to explain that. So in personal assistance, we have that the service is user controlled and directed, so that person with disability have a control over this service. It promotes autonomy, and we are going back to general comment number 5. It has empowering role. It's a tool for independent living. So a person with disabilities can, with the support of personal assistance, can lead the independent life the way the person wants. And care service is completely different thing. It's provider control. Many times, I don't want to say that it's always like that, because it's also changing. But historically, and I think still most of the time, it's rooted in a paternalistic approach to disability. And people with disabilities in this approach are seen more like a patient and beneficiaries, and not like right bearers and people who can have control over their own lives. I want to say, because I work at an economic school in the social policy department, and we also work a lot in the field of aging policies. So I want to say that I do not believe that we need to resign completely from care, from care services. They are also needed, but I believe that what we should really focus on and work on, also at the level of decision makers, is that to make sure that we understand the difference. That this is not the same. This is completely different thing, and the fact that this is completely different thing has consequences. Oh, right now I'm surprised. I thought that there is a different slide here. So maybe I will go to the, yeah, I will go to this slide, and then I will go back to the one I had before. Personal assistance is a new type of service, and it has huge implication on the whole disability support systems. It's based on a different approach. It's also designed in a way to support, to help, and a system based on institutional paternalistic approach to people with disabilities. But when in the whole system, when we look at that the system of supporting people with disabilities in different countries, and we see how much of this paternalistic way of thinking about disability support is still there, the personal assistance is like it's very hard to like implement personal assistance into the old systems of disability support. So what we need is that we need to change the whole system. And what does it mean to change the whole system? Uh, it means that the whole system should be based on independent living arrangements, that we should have not only personal assistance but also supported and accessible housing for people with disabilities, like social housing, that we should have peer support, that we should have supported inclusive employment practices and instruments. We should have people with disabilities should have access to inclusive education, and the system should be designed in a way that this is possible. We should have circles of support for people, like people with intellectual disabilities, people with disabilities, for their families. The system should be built as something in a new approach. The system should be built in a way that it's in line with CRPD. Then personal assistance in this system can be really like, I don't know how to say it, but it will be really empowering for people with disabilities, and it will be really something that it's that that then we can make sure that people with disabilities can really exercise their right to live independently. But of course, the systems are not designed in that way in, I think, any of the countries, even in this dreamland of Scandinavia. People always, like, people in my region like to refer to, like, this dream place, or in Germany. And there is still a lot of work to do. But what I want to say very clearly is that even when we do not have all these other tools in the system, it's still important to have personal assistance, because for people with disabilities, this is really like a very crucial and at the same time very basic support that they need in their everyday life. And now I will go back to how personal assistance should be designed to make sure that it's a tool for independent living. So, and I'm using European Network of Independent Living's guidelines in my presentation, and we have Kamil Gongor from European Network of Independent Living with us. So I hope, Kamil, that then later you will comment on that as well. But what I want to say is that when we are building quality personal assistance services, we should focus on at least on a few things. The first one is that direct payment to maximize choice and control. I don't know if you've heard about the direct payment, but direct payment is, in a very simplified way, you can say that person with disability receive money to and finding herself or himself a personal assistance, and then has a full control over how the service is provided. It's not a choice for everyone, but it should be available. And it should be available for these people who feel that they can they really can use it and want to use it. But at the same time, still there can be other options in the system. Of course, this is the mainstreaming solution are not based on direct payment, but in some countries we have some experience with that, not in Poland, unfortunately. It should be personal assistance should be also provided equally across the country. This is a huge problem. I can. It's easier. It's like for me, it's easiest thing to do to tell you how it looks like in Poland. In Poland, access to personal assistance is very scarce, and it's but at the same time, it's easier to get personal assistance in a city than in a countryside, rural areas, and it's also very hard to have personal assistance whole year around. So it shouldn't be like that. It should be provided equally across the country. And I will also add that the service should be stable. It shouldn't be project based, and it just should be in the system that people should know that they can rely on that. All costs related to personal assisted should be covered. So there is no such a situation that people with disability have to pay for something by themselves. So it just should be covered, and that's all. And also, then there is this huge thing about number of hours. There should be flexibility to determine the number of hours. So for some people, the lower number is okay, but we also have people with disabilities with really high support needs, and they should not be excluded from the service, and still should have access to that. And also, I think this is also a good moment to tell you that there is the right to independent living, and at the same time the access to personal assistance shouldn't be restricted to people with different disabilities. It's for all people with disabilities, no matter how high their support needs are. So it's also for people with severe complex disabilities. And they also have the right to independent living. And another thing is that personal assistance should be designed by persons with disabilities in line with the principles of independent living. So, going back to the beginning of my presentation, it shouldn't be like that, that non-disabled experts are designing the service. And here I am, a non-disabled expert explaining you personal assistance. But yeah. Another thing, which is sometimes in the discussion how personal assistance should be designed, sometimes this thing is forgotten, but it's also very important that when designing personal assistance, we should also be aware that we should provide decent working condition for the people who are doing this service. Stable employment contracts are needed, decent wages, and also visibility and recognition that this is important job, and that it's and maybe also it's important to also work on this like prestige of this job, this is something that in many countries is still missing. But I think that this is something that is especially important for me. It's that personal assistance should have a stable employment contract and decent wages. And especially as in many countries, personal assistants work as a self-employed, and so this is really a precarious job, and it shouldn't be like that. It shouldn't be a precarious job, because this is a very crucial job for many people with disabilities, many crucial service for many people with disabilities. And so people who are doing this job should not be living in a poverty and in a precarious condition. And so we have the perspective how the service should be designed, how the personal assistance, what kind of conditions should they have, and also another thing is like training and support, how the trainings should be designed. And here we have another very important but also interesting thing is that in personal assistance service, it should be that the person with disability is training the assistant. So the trainer, because the person is the best expert on his or her own needs. So disabled people with disabilities provide the best training for personal assistance. Of course, in many systems, we also have like additional trainings that make, I think, from my experience, sometimes it's just for personal assistants to feel safer at their work, especially when it's related like to some medical support. And also, what I think it's extremely important, that there is a training for recognizing the signs of violence and at the same time for preventing harassment and abuse. And I will go back to that in a minute. Okay. I know that the project that we are that gave us the opportunity to meet today is about job crafting. So this is about the realization of the right to work. So it's about Article 27 of the CRPD. But I think it's worth to mention how personal assistance is related to the realization of the right to work. That personal assistance is very much not the same thing as like job coaching. And it's not personal assistance is not supported employment. It's very, very different. It has absolutely nothing in common. But personal assistance is very important also in the relation to the right to work. It can include such a tasks as support in everyday preparation for work, like transport, hygiene, or clothing, but also the assistance with commuting to and from the workplace. That for many of the people with disabilities, even myself, I know many of this such a situation cannot work because they do not have access to this kind of support that they need, support, everyday support in with commuting. So personal assistance is also for that. And what is here very important is that personal assistance is personal. So it's for very concrete individual person, and it's not only at home. That the support is also where the person needs the support. So it doesn't has to be at home. It can be at the workplace. So here about work. But I also promised, and this is also very in line with my interests. So it was an easy promise that I will mention to you a bit about gender and personal assistance, and how personal assistance is not gender neutral. And this is a very complex topic, and I think I can do the whole webinar only about that. But what I want to focus on, just like very briefly, is that we can see the gendered dimension here, the gender dimension here, at least in two ways. And one is from the perspective of people with disabilities, mostly women, like women with disabilities. When we think about how can we protect them from domestic violence? We know that from research across the world, also across Europe, that most of the women with disabilities experienced domestic violence or other kind of intimate partner violence, sexual abuse, all different kind of violence during their lifetime. It's like some statistics says that it's even 80% of women with disabilities. So this is a really huge percentage. And when we have independent living support systems, when we have personal assistance, but also other instruments in the system, we can protect women with disabilities from from this experience. And also, we increase the chances of stopping domestic violence. And it's from this very simple reason that, especially in the countries where um, the whole care is mostly informal and provided by the families, there is when there is a personal assistance, there is like another person that is entering the place. And at the same time, personal assistance can prevent people from going to institutional settings, like a different kind of care homes, which are also places when abuse can happen. So personal assistance is also crucial in that way, that it helps us protecting people with disabilities, mostly women, from experiencing violence. So this is one thing. And there is also another, like very different point of view, is that personal assistance means a reduction in dependence on informal care provided mainly by women. So, when we provide a very good, stable, high quality personal assistance service, we what we are doing is we also giving like the independence and the right to independent living also for the informal carers, mostly women. So we can look at it both ways, I think. This is my point of view on that. I don't know if you agree. And then very briefly, and I said at the beginning that I thought that my presentation will be half an hour and I'm already talking 45, but very briefly, I want to tell you a bit about personal assistance in Poland, because we are in a constant fight for a Personal Assistance Act. At the beginning, very short introduction to the topic is that not even 1% of people with disabilities in Poland has access to this service. We have a personal assistance program, but it's project-based and it's not very stable. And the municipalities can decide if they want to join the program. Many of them won't. It's neither universal nor guaranteed, and often misunderstood as care services, but we are doing better. I think that there is a growing number of people who understands what personal assistance is, and also the understanding it's increasing also amongst decision makers. And this is because of the very active disability rights movement in Poland, independent living movement, people who are fighting for personal assistance. Um, we have, because maybe I will do that like that. For the 3 or 4 years now, we have repeatedly have protests of people with disabilities who are fighting for Personal Assistance Act. They reach they make this promise of Personal Assistance Act finally reaching the political agenda, that politicians are declaring that they want to provide this service. They really reach like national. I think the protests reached like nationwide recognition that personal assistance is needed, that we need Personal Assistance Act. There was this slogans in this protest like we want to live, not just survive. Personal assistance is the best investment. And actually, what happened, and I think it's really like the first time in Poland when people with disabilities on such a large scale are fighting for their rights, because we have a history of protests of people with disabilities, but most of them are actually the protests of the families or the carers, the mothers. And here, people with disabilities, together with the mothers and non-disabled allies and many other people, are fighting for personal assistance. And what happened? It was the current government promised Personal Assistance Act in the so-called 100 concrete measures. So it was one of the promises made before the election. It's there, it's written. Of course, it's not fulfilled yet. Yeah, but we have a draft that was subject to public consultation. At least, actually, there was during the last 3 years, it was three different drafts, but the one that reached the parliament and is more likely to be implemented, it's really in line with CRPD. It can, if it happens, if it really happens, I believe so, but still have some doubts. And most of my doubts are because this Poland is quite a large country, and so the service is really expensive. Uh, but we are talking here about even 240 hours of support per month. It's not ideal, but it's much better than it was before. We are talking about nationwide legislation, so it's not going to be project based anymore. We are talking about support available in employment, education, in communication, in different areas of life. And if it happens, it will benefit more than 100 people with disabilities. Thank you very much. Here you have my email address. If you ever want to contact me, feel free. And now I will stop sharing.
Thank you, Magdalena. And now we can open some minutes for question and answers. So if some of you have something to ask to our speaker, so it's not the time. Yes, we have now one question for Katarzyna. You have a microphone. If you want to talk, you can talk.
Yes, it's on, I hope.
Yeah, yeah.
Yes, so
We can hear you.
thank you for your enlightening presentation, Magdalena. I really enjoyed that. You mentioned that there is a gender dimension to the personal assistance, and I was wondering whether there is also an age dimension, because in this project we are also interested in young people with disabilities. So perhaps you could tell us whether there are some services that personal assistants could provide that would be very beneficial to younger people with disabilities. Maybe something
Yes,
about
of
this.
course. Can I answer right away? So yes, there is an age dimension and a very important one. And this dimension mostly is about the fact that young people and people under 18 or under our children are excluded from the access to this service in many cases, and they should be not, because I think to make sure that personal assistance is really about ensuring the right to independent living, it should be provided in a very early stage. Because when an older person with disability have the access to the service for the first time, it takes some time to, I mean, they're like in a different system, I think it's important, but I think when we start early, the outcome will be better and people can really have
Yeah.
access their rights. So this is the first thing. And the second thing is the fact that there is this huge discussion, should we include older people in the service. And this is also it's also important due to the fact that we are in Europe, we are facing the fact that our societies are aging very rapidly. So when we include older people with disabilities, then the service will be really expensive. So that there is this discussion around that. So I personally believe that we shouldn't exclude people from personal assistance, but at the same time, I know that like the budget restriction is a real thing, especially in such a big country as Poland.
Thank you.
Thank you, Katarzyna and Magdalena. Okay, so more questions for yeah.
I see that there is a question on the chat.
Okay, let's see. Yes, for Agnieszka, which country, in your opinion, has the best functioning personal assistant system? Is it possible to compare this in some way?
Camille, I will need your help on that. But what can I say is that when we were trying to design the personal assistant standards in Poland, and I was involved in that, and also then a draft of the legislation, it was we really look up to Slovenian legislation. That we thought that Slovenian legislation is really good, but Slovenia is a small country. So it's very hard to compare it, like really. Yeah, that. Yeah. So I think it's just it varies in a different countries. I think that we can start with the fact that some of the countries have a personal assistance acts, so they have a legislation, and some of the countries still do not have that. So yeah.
Thank you,
Camille?
Magdalena.
Thank you for your presentation, Magdalena. It was great, really. And so, I mean, you said everything. For the question, this particular one, I mean, at the NIL, the European Network on Independent Living, we had collected and we continue to do that. It's an ongoing process, data about independent living in whole Europe and even beyond sometimes. And we try to, we get often this question, what is the best system? I mean, there is no perfect system, first of all. All systems have issues. And second, the best system is also a very relational issue because it depends also on the country, of the region, of the culture of a place. So a best system for me is not necessarily the best system for another country. But I mean, the good systems in theory are the Nordic ones. These are the famous ones. Sweden, Norway, they have good system. Denmark, Finland. I mean, all of them have some sort of systems. But nowadays they do steps back, so they lose funding and people lose their assistance because governments allocate the budgets to other stuff, or I don't know, there is no new activists to push, and there is just the rest of what they achieved some years ago. So there are quite a few issues. Slovenian is a very good system, of course, and is the one we recommend to the country when they tell us, yeah, okay, Camila, cannot be Sweden. I mean, in our country, we cannot be Sweden. Okay, but you can be maybe Slovenia. Of course, if you ask Slovenian people, they will tell you it's not perfect. They have a lot of issues as well. But it's a good system, and Anka, I can put in the chat a guide handbook they wrote about personal assistant. It's like a book about PA in Slovenia, and it's very helpful and easy to read. And I mean, then you have systems now emerging all over Europe, new, and the discussions are coming. In Greece, we have a new system now. It's a pilot, but I live in Greece. I'm originally Polish, but I live in Greece. We have a new system. We brought the legislation after many years, but it's quite messy and it has a lot of problems. The ones that Magdalena said we should avoid, most of them we didn't avoid. But okay, we are working on that, and it's something. So it's good to see new countries coming to the PA system. And I stop because I can give a speech about the topic, but it's Magdalena is the protagonist here. So next time.
Thank you, Carmen, for your intervention. So helpful, and I think it's a very good vision. Okay, so more questions or comments? We are almost at the end of our webinar. If you have more comments or some questions, you're more than welcome to this webinar. Okay. You've seen
Maybe one more thing to make the discussion, to put some fire on the discussion. So one small part I didn't completely agree with Magdalena. I mean, it's very big. I mean, there are many debates and things are difficult. But you said at some point that PA could protect people from violence and stuff like that, which on a human level, yes. But if we take very strictly the job description, they shouldn't, because a PA is my hands and my legs, and it's not there to protect me. If I don't want to protect myself, it's my problem. If I do stupid things, PA is not there to save me. If I don't want to take medicine, PA shouldn't force me to take my medicine. So this is very theoretical. But yeah, I guess most PAs will jump in and try to save your ass if you do stupid stuff. But
This is extremely interesting, and I hope to discuss it with you more at some point. Yeah, we should have a discussion about that. Okay. So,
Yeah, probably it will be for another webinar, a debate about the role of the personal assistant. So, which is the limit? And yes, I think it's so interesting. And I also heard some debate about that in Spain. So, I think it's a universal debate about that. Yeah, yeah. So, maybe in the next webinar we can make a debate.
thank you very much.
Okay, so in the chat, we have some links. Okay, thank you, Camille. Okay, so if it's not more questions or comments, we can finish our webinar here. Thank you again to Magdalena for this interesting presentation. And we will meet probably at the end of June with another webinar, our fourth of our project. So we invite you to join again in our next webinar. So have a good week. Bye bye.
Thank you very much.